name is Advocacy. I am the founder and the director of Humanity for Orphans and Some Widows Initiatives Kenya, that is HOYWIK. Basically, HOYWIK works in Kenya, and our main area of focus is on advocacy and awareness creation, whereby we want to enlighten the society about the predicaments which are there, the incidents that are affecting humanity in general. And I'm happy to report, also share some of the insights that we have been able to articulate here within since our inception. So I will take you through a couple of programs that we have managed to roll out. Number one, as far as the organization is concerned, we've been focusing much on education, whereby we are trying to assist the needy in the society that are orphans, children that have been left orphaned because of HIV/AIDS, or their parents have died because of other various diseases here. Another component that we address is human rights, where we want to make sure that their needs are valued, they are appreciated in one way or the other, and it's an area that we are really struggling to make sure that we put more emphasis on human rights abuses within the community. We have also been able to address concerns on women, and on the women's side we are trying to propel the idea of gender-based violence within the community and its environs, whereby we are trying to bring women to be able to understand on their individual rights. Youth empowerment is also another pillar within HOYWIK, and we are trying to engage young people to to be able to acquire technical skills, also be able to network them to access job creation here and there. So one of the current program that we are rolling up, and which have really made us to know some of the challenges that we've been having, is on the advocacy under health intervention. And under health intervention, here we are implementing a project on global hepatitis elimination, where we are partnering with the Coalition for Global Hepatitis Elimination to increase awareness among the stakeholders about the importance of the hepatitis B on the newborns, focusing on vaccination, treatment, screening in the communities within Kenya. And when we're talking about hepatitis B, this is a disease that is really affecting the society currently. Even in the entire world, people are being diagnosed with this disease, and in Kenya is not left behind, because majority have succumbed to death out of hepatitis B, especially on the infants, children. And some of the components that we want to make sure that our society is free from from the disease is increasing awareness, intervention within the community, so that the target group that we are reaching into are able to be more conversant with the disease and take early precaution, get tested, screened up, and get vaccinated. So it's an area that we are currently doing a clear advocacy to increase vaccination coverage within the community and Kenya at large. Another component is also on the increased knowledge and awareness that I have already shared. We just want to make sure that the society is being capacitated to be able to know the incidents incidences and how they can take their prevention measures as far as the hepatitis B is concerned. We don't want to leave the community out of this, and here whereby we also are working with the stakeholder under stakeholder engagement to make sure to measure the number of the actively involved the civil society, the NGOs, the faith-based organizations, the community health promoters. So we bring them on board to be able to propel the agenda of hepatitis B elimination within Kenya. Policy and guidelines changes, we are trying to monitor the changes that are there, and even the gaps which is there to be filled. And here we are trying to bring about the change in terms of the intervention, because we have come to realize that the vaccination or the vaccines are not sufficient. Most of our public health facilities lack this vaccination, and perhaps maybe because we have weak policy. This is where the Ministry of Health being encouraged to design a policy that can enable the national government to address this, and also avail resources to address the vaccine challenges here and there. The other component under our project goal of increasing awareness is also on availability of resources, because we have come to realize that the resources is very scarce, and even in the national budget, the national parliament has not made a good budget to enable the Ministry of Health to roll up the vaccine uptake to the remote areas. So it's an area that perhaps maybe with our intervention and also from partners, we will be able to propel this agenda, and we are going to task the National Assembly to enable them put up a bill for the Ministry of Health to be given enough resources to be able to purchase the vaccine and decentralize these vaccines to the county level, to the national hospitals, and also to the grassroots health facilities, so that the access of the availability of this vaccine can be made very possible and in a larger quantity. To enable us also to propel the awareness creation, we are also working with the media and digital engagement, whereby this area I want to echo my team under the volunteers. They have really managed to engage the public for sharing this information on hepatitis B, the incidences, and also on the vaccine uptake for the disease. And I believe through media outreach, we will be able to tap in the number of populations, because at the moment we found that the majority of this community are digitally connected. So we are trying to embrace this, and I must applaud the various media houses like KTN News. They came to highlight some of our interventions, especially on hepatitis B and also other programs that HOYWIK is implementing within the community. So this area of media, social media coverage, it's one critical area, and it's a good avenue for us to tap in terms of sharing the information, where we are able to reach almost 3,000 in this particular quarter, and we still embrace this, and we will be able to move with high speed, so that we will be able to continue targeting the unreached people through the social media engagement. Collaborations and partnership is also another component of HOYWIK, and we have managed to bring several actors on the community NASCOP, which is a creation of the Ministry of Health. We are on board with them, and with NASCOP, we are trying to redefine the policy gaps which are there, and we have the document with us. We are trying to identify the gaps which are there, so that we'll be able to also share our input, so that the National Assembly can enact a good document that will be able to safeguard the entire nation as far as eliminating of hepatitis B is concerned. The National Syndemic Disease Control Council is also one of the organizations that we are working with. The National Council for Population Development. We're also engaging with them to tackle issues to do with teenage pregnancy. This is an avenue that we want to tap in, and we continue propelling this agenda together. We have also Global Health Action, which is also a partner based in the United States, and is trying to help us in redefining community health needs assessment, where we want to understand the nitty-gritty within the community. We also have Fresh Inspiration, which is also a very strong faith-based organizations that are also working with us to continue sensitizing the society on the incidences of other non-communicable diseases that are within us. And I cannot, forget to mention our main partner that has made this program to be run all over. That is Coalition for Global Hepatitis Elimination. They have really enabled us to increase awareness among the stakeholders about the importance of hepatitis B vaccination in the community within Kenya. And we continue bringing new ideas. And one thing perhaps maybe I can talk about is the basis of the challenges on there. There is a community, a very special community that has not been targeted, and I must applaud my team.
Hello, my name is Goreti Akini. My sign name is Goreti. My school name is St. Angela Juniors Secondary Vocation for Deaf Girls. I'm in Form 2. Welcome. We want to talk about hepatitis B. Topic: let's stop hepatitis B on our newborns. Protect your newborns. Get vaccinated against hepatitis B. Do you know that hepatitis B can be transmitted from mother to baby during childbirth? your baby's future with simple hepatitis B vaccine within 12 hours of birth. Don't wait. Vaccinate. Schedule your baby's vaccination appointment today. Keep your baby safe and healthy. Get informed about hepatitis B prevention. Protect your health care. Provide or visit a nearby health facility. Hashtag prevent hepatitis B. Hashtag vaccinate your baby.
That identified this. By the time when we were designing the proposal to be given to the Coalition for Global Hepatitis Elimination, we didn't think about the deaf community. And we realized for us to incorporate awareness targeting this marginalized group, we need to bring these people on board. And it's an area that is now coming up, and we need to continue embracing under our cooperation and partnership building to be able to bring this forgotten society on board, so that when we are talking about hepatitis elimination, everybody should be on board. I want to really thank our partner once again for allowing us to work with us, and I'm very optimistic that by the end of the project time frame, we will be able to reach over 10,000 families with awareness. And this is one thing that it is a testation that we have done, and based on almost 5 community outreach programs that we have managed to have established, the awareness as far as hepatitis B is quite low, and this is an area that we still need to embrace, and that's why we are calling all parties that are practicing health, or the professionals, to join hands so that we will be able to reduce the virus by at least to a 0% in terms of transmission. So it's an area that we still continue to ask individuals of goodwill, partners, to continue opening their doors for us, so that we embrace and be able to mobilize enough resources to tackle this virus. As far as also our project outreach intervention, we are planning to have a very serious program in Homa Bay, as well as Turkana, Siaya, Kisumu, and Nakuru, so that we will be able to sample in the kind of information that is going out, even what they have already on the ground, so that this will also be a clear justification why resources needs to be channeled. Because as far as we are concerned, based on the general baseline survey that we have done, almost 80% of the populations that we have reached does not know about hepatitis B. And this is a case there where we're calling all the health practitioners to come on board and embrace the hepatitis B on our newborns. And we will continue working with the pregnant mothers, breastfeeders, to be able to tell them, also share with them the kind of, the symptoms and also how they can also prevent their infants from getting, being affected. And I want to thank the entire team, the crew that made this publication or documentary to be made open, and we share our best practices with other organizations. I thank you all, and God bless you as you carry on the program.